No, I was curious because I wanted to ask Dr. Teo, you know, if I had prevented this when I was younger, would it have would it have had made a big difference, versus, you know, starting now when I'm, you know, in my 30s.
Well, I think what both of you have shared is very helpful for our viewers, and I'm sure many of them have similar questions. Now, what you said, Victoria, about prevention being better than cure or treatment, it does hold through in many aspects when we talk about hyperpigmentation. But, going back to your specific question as to whether your sun exposure would have made a difference to how your skin looks like now, how it will look like in 10 years, 20 years. Well, the answer is the science tells us that yes, there is a significant component of hyperpigmentation, especially in terms of photoaging, which is primarily the mechanism of skin aging, because of environmental factors. So UV exposure, but we are also quite blessed, to have more melanin in our skin. So compared to, say, our Caucasian counterparts of the same biological age, we are expected to have lesser signs of photoaging simply because of our innate photoprotective capabilities of increased melanin. Now, I think we want to highlight the significance of thiamidol here because it's actually been found to be the most effective tyrosinase inhibitor. So even when you compare it to other very well established, well-known active ingredients such as arbutin, kojic acid, we find that in cell cultures, thiamidol had good abilities and superior abilities to inhibit tyrosinase. And, something that perhaps our viewers may find interesting is that a lot of prescription pigmentation treatments, so we mentioned hydroquinone a lot because that is, for a long time considered to be the gold standard of pigmentation treatment for melasma. We also use it together with laser treatments for sunspots. It's actually quite well known to have certain adverse events, and not just skin irritation, which we talked about earlier, but also rarer side effects such as rebound hyperpigmentation, where the pigmentation, instead of becoming lighter, after a few months of using the product, actually darkens your skin. And also something known as chemical leukoderma, where the skin cells actually lose even their natural melanin and the skin becomes depigmented. And these are certainly adverse events that we want to avoid when treating hyperpigmentation. And, besides that, I think that, the value of thiamidol, it being highly tolerable, is that it's also appropriate for use in disorders such as post-inflammation hyperpigmentation, such as what arises from eczema, dermatitis, as well as acne scars, because traditionally these conditions can be triggered off by hydroquinone.
I see. Thank you so much, Dr. Teo, for sharing.